Let's now transition to talk about mental and physical. What is healthcare? When most people think of healthcare, they think about healthcare coverage, the insurance plan that they have or wish they had in order to offset the outrageously high cost of medical services in this country. In this presentation, when I refer to healthcare, I am referring to the care provided by doctors, nurses, mental health therapists, and a host of other caregivers in order to prevent illness or to recover from illness that was not prevented. I am not referring to healthcare coverage. Note, ironically, most of the information in this part of the presentation comes from Cigna Healthcare Company's article, LGBT Health Disparities, that was published in February 2017. Here's a little cartoon. So, how are you today? Says the super glue to the broken coffee cup. This picture represents what I mean by healthcare. The coffee cup with the broken handle is a person in need of physical care to fix her handle that's broken off. She also needs mental health care to help her address her negative emotions. How do I know she has negative emotions? Well, does she look happy to you? Or perhaps that's her angry, suspicious look because she is queer and is distrustful of medical professionals, represented here by the superglue, who are supposed to help, but often do more harm than good for LGBTQ plus folks. Why is healthcare important? Healthcare is necessary for society's survival. In order to survive, every society must be able to do the following. Repopulate. Healthcare helps people live longer and helps to solve infertility issues. 2. Socialize new members. Healthcare teaches us how to stay healthy. Wear that mask. 3. Preserve and distribute goods and services. The main good is medicine. The main service is, of course, medical treatment. 4. Preserve order. The Center for Disease Control sets the regulations on when, where, and how we interact during COVID. Provide members with a sense of meaning and purpose. Healthcare can help people want to live by helping them to manage their pain. Chronic pain, whether physical, mental, or relational, can make people want to give up and die. LGBTQ plus health disparities. Health disparities. What are health disparities? Health disparities are differences in health between different groups of people. LGBTQ plus people experience a number of health disparities. They're at higher risk of certain conditions, have less access to health care, and have worse health outcomes. These disparities are seen in the areas of behavioral health, physical health, and access to care. Behavioral health disparities. Behavioral health. Behavioral health includes mental health, substance abuse, and addiction. LGBTQ plus people are at a greater risk of suicide and suicidal thoughts, mood disorders and anxiety, eating disorders, alcohol, tobacco, and substance abuse. Physical health disparities. Physical health. LGBTQ people are at a greater risk for certain conditions, diseases, and infections. Queer folks are more likely to rate their health as poor and report more chronic conditions. Lesbian and bisexual women have higher rates of breast cancer, and transgender men and women are at a greater risk. Queer folks have higher rates of HPV infection. Lesbian and bisexual women may have a higher risk of cervical cancer, and gay and bisexual men may have a higher risk of anal cancer. Queer folks are more likely to be obese. Gay and bisexual men are more likely to have AIDS, HIV. Access to care disparities. Access to care. LGBTQ plus people have less access to the health care they need. LGBTQ people are less likely to have health insurance, which means they're less likely to fill prescriptions, more likely to use the emergency room or delay getting care, more likely to be refused health care services and be harassed by health care providers. What causes these health care disparities? There are many causes. These include healthcare workers who are not trained in or sensitive to LGBTQ plus issues, a lack of clinical research on LGBTQ plus issues, restrictive health benefits that may not cover certain treatment. Health insurance often doesn't cover gender confirmation surgery for trans individuals. Fear of going to the doctor due to stigma, discrimination, and institutional bias. A reluctance to seek treatment in order to avoid microaggressions such as being misgendered or being called by one's dead name, the old name the person no longer uses. Having to complete forms that only offer the binary as gender categories. Fear of going to the doctor due to stigma, discrimination, and institutional bias. Certain states, like Florida, criminalizing gender-affirming medical care for trans youth. The high cost of care. People of color have worse health, lower job security, and less income than the general population. When a person is LGBTQ plus and a person of color, they experience double jeopardy, and their likelihood of finding and obtaining adequate, affordable, culturally sensitive care is even lower. The stigma associated with obtaining mental health care. The National Association of Mental Illness, NAMI, describes stigma as the feelings of shame or judgment a person feels for having a mental health care need. People of color and LGBTQ plus individuals are especially concerned about the stigma of being labeled as mentally ill, given how psychiatry has historically been used against minoritized communities. Psychiatry's harm. Key dates. April 1952, the American Psychiatric Association, APA, Diagnostic and Statistical Manual of Mental Disorders, the DSM, lists homosexuality as a sociopathic personality disorder. Again, that's April 1952. Aversion therapy. This is a type of behavior therapy designed to make a patient give up an undesirable habit by causing them to associate it with an unpleasant effect. This is commonly used in the 1950s through 1960s to, quote-unquote, cure men of homosexuality. Psychiatry's harm, page 2. December 15, 1973, by a vote of 5,854 to 3,810, the American Psychiatric Association removes homosexuality from its list of mental disorders in the DSM-2. Woohoo! However, The APA comes up with a new disorder, which they call sexual orientation disturbance, for people in conflict with their sexual orientation. Not until 1987 does homosexuality completely fall out of the DSM. Psychiatry's harm, page 3. Since the 1970s, reparative therapies have been used in ex-gay Christian ministries, including the umbrella group Exodus International, founded in Anaheim, California in 1976. Mixing pastoral counseling, Bible study, individual and group psychotherapy, and aversion treatments, ex-gay ministries have promised a cure from, or at least avoidance of, homosexuality to thousands of men and women. Exodus International shut down in 2013 with an apology from its leader for giving false hope. However, the wider network it spawned, Exodus Global Alliance, continues to operate. Source: Time article on attempts to cure gay people. This billboard that says 3 words, gay, unhappy, www.exodus.to, is an example of outdoor media. Before Exodus International closed in 2013, this type of billboard was used to encourage gay people who were unhappy being gay to contact Exodus International. Psychiatry's harm, page 4. The American Psychiatric Association acknowledged the risk of reparative therapies in 1998, listing depression, anxiety, and self-destructive behavior as likely outcomes, but has likewise failed to outlaw the practice among their members or charge reparative clinicians with professional misconduct. Action has come instead through state legislatures and the court. Reparative therapy for minors is now illegal in 20 states, with California being the first state to ban its practice on minors in 2012. Unfortunately, conversion therapy, the other name for reparative therapy, can still be practiced on consenting adults. Source: Time article, Attempts to Cure Gay People. Psychiatry's harm, page 5. One of the leading organizations working hard to criminalize the use of conversion therapy on minors in all 50 states is the Trevor Project, with their 50 Bills, 50 States campaign. For more on the harmful practice of conversion therapy, watch this 3.5-minute video, The Dark History of Conversion Therapy. Psychiatry's harm, page 6. The Trevor Project is the leading national organization providing crisis intervention and suicide prevention services to lesbian, gay, bisexual, transgender, queer, and questioning youth. Psychiatry's harm. Conversion therapy, sometimes referred to as reparative therapy, is any of several dangerous and discredited practices aimed at changing an individual's sexual orientation or gender identity. Conversion therapists use a variety of shaming, emotionally traumatic, or physically painful stimuli to make their victims associate those stimuli with their LGBTQ plus identities. According to studies by the UCLA Williams Institute, more than 700,000 LGBTQ plus people have been subjected to the horrors of conversion therapy, and an estimated 80,000 LGBTQ youth will experience this unprofessional conduct in coming years, often at the insistence of well-intentioned but misinformed parents or caretakers. Source: taken from What is Conversion Therapy? The Trevor Project. Resources: The Gay and Lesbian Medical Association, GLMA, mission is to ensure equality in healthcare for lesbian, gay, bisexual, and transgender LGBTQ individuals and healthcare professionals. Visit www.glma.org for more information. The World Professional Association for Transgender Health, WPATH. Their mission is to promote evidence-based care, education, research, advocacy, public policy, and respect in transgender health. Visit www.wpath.org for more information. What can be done to reduce health disparities? Educate medical care professionals about the diverse needs of LGBTQ plus people. Create a welcoming environment by having inclusive intake and information forms. Make sure there is a place on forms for patients to list their pronouns and preferred name, and then only refer to patients by their preferred or chosen name and pronouns. Hire LGBTQ plus medical professionals who are queer identified. Have magazines that target LGBTQ plus community in the waiting room. Lobby Congress to make healthcare more affordable and more inclusive. Summary. Yay! We're finally at the end. Woohoo! Okay, let's recap. In this presentation, we have done the following. We've defined media and distinguished between two main categories of media and 4 different types of media. We've reviewed the functions of media. We've explained how media and healthcare contribute to a society's survival. We've discussed how media can be used to help or hinder the pursuit of justice. We've discussed how censorship has impacted the media. Discussed queer coding and queer baiting and their relationship to censorship. Reviewed the various physical, behavioral, and access disparities facing LGBTQ plus individuals. Reviewed the harmful role psychiatry has played regarding LGBTQ plus people, and examined ways to increase access to healthcare and reduce disparities. Woohoo! We are done. That's it, folks. The end.